Welcome to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today, it's with great pleasure that I introduce Dr. Cynthia Downard. Dr. Downard is the Surgeon-in-Chief at the Children's Hospital of the University of Louisville, where she is also a professor. Welcome, Dr. Downard.
Thank you, Dr. Wexner.
One of your many roles in service to the American College of Surgeons, besides being on the Board of Governors, is as a representative of the Board of Governors to the program committee. This year we have a rather different program, being virtual, and your specialty, no pun intended, is one of the smallest, but a very important one, being pediatric surgeons, at least, shall we say, and people trained in general who then subspecialize, because I think both vascular and colorectal are even a bit larger, but form a very important constituency. Could you tell us a little bit about some of the features on the program, A, of interest to pediatric surgeons, and B, of interest to, if the appropriate term is adult surgeons, about pediatric topics?
Sure. So there's often a lot of crossover between pediatric surgical topics and adult surgery topics. Some that immediately come to mind are appendicitis, and we have at least 2 sessions looking at updates on treatment of appendicitis, the latest results of the CODA trial as well. Those, I believe, are on Monday. We also have topics of interest to general surgeons, such as firearm violence in children and how that differs from the phenomenon that we see in adults. We have a session on inflammatory bowel disease in children, and that's certainly something that as those teens progress to adulthood, often transition to adult surgeons, adult colorectal surgeons for their care. So those areas all are areas of common interest. There is a session that we are involved with the gynecologist looking at unexpected pelvic findings during non-gynecologic surgery. And that's something in pediatric surgery we encounter relatively regularly.
Thanks. That's certainly sounds like a lot of interesting topics. Are there any speakers in particular who you would highlight, for fear, of course, of omitting others, but if you could just kind of pick a few who might interest the general surgeons attending the meeting?
Sure. So I'm intimately involved co-moderating the session on firearm violence in children, and so I'm most familiar with that. We have an all-star lineup of David Foley, who is a pediatric surgeon here in Louisville, looking at our current demographics and who is being injured by firearm violence, specifically in the COVID era. Dr. Mike Hirsch, who led a gun buyback program in his area. And then interestingly, Hannah Sachs, who leads the firearm violence prevention effort at Mass General Hospital. And then Robin Cogan, who is a school nurse who really is at the crux of the issue as it deals with schools, and particularly again within the COVID era. It's very alarming what's going on.
Now, as I mentioned, pediatric surgeons are a critical part of the American College of Surgeons, but are certainly not present in a huge proportion. What entices a pediatric surgeon to come to the ACS as opposed to, or presumably in addition to, a pediatric surgery meeting?
So there are several things that make it a very attractive meeting for pediatric surgeons. One is that we are absolutely loyal to the American College of Surgeons. We have, I believe, 3 regents currently on the Board of Regents who are pediatric surgeons. We are first and foremost general surgeons, and some consider us the last bastion of general surgery. So we take care of the whole body. The other thing too is the price of this meeting is you can't beat. The registration is free. It's available, once the sessions are released. I believe this is being run as the Quality and Safety Conference was, where the sessions are going to be available after they're released, basically around the clock during the time of the meeting. And those opportunities are hard to beat elsewhere. So plus we adapt a lot that we learn in adult general surgery to pediatric surgery. And so I think keeping up with the latest and greatest of what's going on in the different subspecialties keeps children at the forefront of our minds as well. So.
Good. So you mentioned the interdisciplinary elements in some panels with trauma and some panels with GYN and presumably GI surgery and the like. And you've spoken a little bit about differences or similarities between general and pediatric. What about as we go through practice span? Because there can be a lot of medical students, we assume, registering as they work for quality and safety. residents in general surgery, as well as international surgeons. And there may be some subtle differences internationally, there may not, but certainly there can be differences in terms of levels of training and seniority. Perhaps you could tell us about some elements of the program you think would be particularly useful for med students and residents first.
Sure. So as the program committee, we tried to expand the weekend programming, and that's on Saturday and Sunday, to make sure that we optimize the time where we thought that medical students and residents would have the most availability. And so the scientific forum sessions are being largely held on the weekend. I believe there are 4 pediatric surgical sessions that are being held during that time period, and all the rest of the scientific forum as well. There's also specific resident associate society programming that's happening on the weekend, so that you do not have to take, hopefully don't have to take time away from your clinical duties in order to attend. That's a little more difficult to do, I think, as a resident or medical student. So,
and there may not be anything uniquely germane to the international audience, is there?
There certainly are programs that were sponsored by the Global Surgery Committee, and but the reality of having this available online in a multitude of formats and time availabilities, I think, really includes the international constituency, where it may not have been possible to travel to the area where the meeting was being held before. So that's definitely an intent, is to make that available for our international audience.
Yeah, I think no doubt that's the case. And then lastly, I'm sure, like all others of specialty groups, there are certain social aspects to the annual clinical congress, which we avail ourselves, whether it's a reception or dinner or a special lecture set aside, or even a hotel suite where people get together and reconnect. Is there any kind of provision for that type of activity in the virtual congress?
We certainly have the opportunity to connect. I don't know that it's specific for pediatric surgeons, but we have tried to highlight the named lectureships so that would be a focus of the entire meeting at one time, so that there are not competing named lectureships. We also are having the convocation still scheduled for Sunday evening, again, viewable virtually though at different times if need be. So there are still opportunities like that, and definitely an opportunity to connect with your colleagues. Most of the sessions too will have a chat function, so that if you have specific questions for those who are giving the presentation, they may not be able to be answered synchronously at the time of the presentation, but can be recorded and then forwarded to those who've presented, so that they can answer specific questions after the fact.
Well, fantastic. I know you've put a huge amount of work into the program, and I'm absolutely confident that it's going to be evident every minute of the 5-day program, as well as you mentioned, being archived thereafter. That perhaps one of the advantages of the virtual congress is unlike running around McCormick as had been planned, where you have to pick session A or session B, session A now and session B later or tomorrow. That could be a distinct advantage. Well, any other last remarks?
No, I would encourage everyone to attend. I think that the Quality and Safety Conference was fantastic, much beyond my expectations, and really allayed a lot of my fears that I've had in being very involved in planning the clinical congress sessions. It's exciting. The content is maintained. The education is outstanding, and there's been a lot of work behind the scenes, and I think it's going to go really well.
Thanks very much for all that you do for the governors and all that you do for the program committee. Looking forward to seeing you at an in-person function at some point, hopefully in 2021.
Thank you. Thank you. I appreciate talking with you.